Hello everyone, and welcome to this short video where I'm going to be discussing essentially what causes diarrhea. So my name is Alex Manos. I am one of the co-founders of HealthPath, and I am an Institute for Functional Medicine certified practitioner with a background in nutritional therapy. So I have a master's in personalized nutrition and I have a degree in nutritional therapy, and I am host of the HealthPath podcast. So if you enjoy our content, guys, we would so love you to like our content, to subscribe to our channel. We are going to be releasing numerous videos similar to this one on different symptoms and conditions. And leave us a comment. Let us know what you think. Let us know if you would like us to put a video together based on something that you are struggling with, because we are essentially here to help. So the objectives really are to summarize the underlying causes. What are some of the underlying imbalances that can contribute to diarrhea? And we're going to also discuss some of the relevant tests based on that. And we'll summarize from a general perspective certain interventions from a dietary, lifestyle and supplement perspective that we can consider when we're struggling with chronic diarrhea. Because really we are talking about chronic diarrhea in today's video. And I want to just very quickly separate out the concept of acute versus chronic, because acute is normally something that will last only for a few days, put simply, and it will often clear on its own within 5 to 10 days. When we talk about chronic diarrhea, we're really talking about someone who has been suffering for 4 weeks or longer. And this has to be investigated by a GP to ensure that there aren't any underlying imbalances that would require further treatment. So chronic diarrhea is defined as the passage of loose or liquid stools, an urgent need to evacuate or feelings of abdominal discomfort, increased frequency of these, and it has to have lasted for 4 weeks or longer. Now, these are some of the more common underlying imbalances or causes of diarrhea. So starting at the top, we can see that inflammation may be associated with inflammatory bowel disease can contribute to diarrhea. We will see various types of infections, whether that be parasitic or bacterial in nature. There are various medications and therapies that can contribute to diarrhea. So for example, sometimes people experience chronic diarrhea after a course of antibiotics, or perhaps they have been placed on proton pump inhibitors. But there are other medications such as antidepressants and non-steroidal anti-inflammatory drugs that can contribute to this as well. The endocrine system can come into play. So if people have hyperthyroidism, then this has been associated with diarrhea. Small intestine bacterial overgrowth, celiac disease. We can experience exercise-induced diarrhea if someone is doing excessive amounts of endurance exercise, for example. Bile acid malabsorption, which we'll be expanding on today. Diverticulitis, dietary reactions such as those to FODMAPs, for example, and maldigestion and malabsorption that is either associated with anything we've just listed or potentially with anything else that could be contributing to maldigestion and malabsorption. So to kind of summarize and to give you an indication of this is all in the research, this paper is a fantastic one that summarizes the common, infrequent and rare causes of diarrhea. Now there's a little bit of debate open to whether some of the factors in the infrequent box should actually be in the common. And I'm going to touch on one of these, which is, you can see that in the first box, or in the common box, the first bullet point is IBS diarrhea. But that's not particularly helpful. Many of us are aware that IBS is a diagnosis of exclusion. IBS stands for irritable bowel syndrome, and we receive that diagnosis when all the conventional testing has come back normal, but we are experiencing symptoms of digestive issues, diarrhea in this instance, but it can also be constipation, abdominal pain, bloating, and similar GI symptoms. Now, according to some research, SIBO, or small intestine bacterial overgrowth, is one of the most common causes of IBS diarrhea, but also IBS constipation and IBS mixed. So I would argue that small intestinal bacterial overgrowth should actually be in the common box rather than the infrequent, if we are saying that IBS diarrhea is in the common box, if that makes sense. But we can see here bile acid diarrhea is an incredibly common cause of chronic diarrhea. There can be dietary reactions, as we mentioned earlier. Inflammatory bowel disease has to be ruled in or ruled out, as does celiac disease. We need to check if people are on medications. And we're going to expand on some of these more common imbalances in today's video. So with that in mind, having summarized all of the underlying common causes of diarrhea, what can we do to confirm which one of those might actually be contributing to our own chronic diarrhea? Well, we can do comprehensive stool testing, which we'll expand on in a second. This is going to be giving us an indication of bacterial, fungal, parasitic status. It's looking at that microbiome, but it will look at calprotectin, an inflammatory marker. It will look at pancreatic elastase to give us an indication of whether there could be some maldigestion and malabsorption going on. We can do a SIBO breath test to rule in or rule out whether small intestine bacterial overgrowth could be contributing to the diarrhea. Lactose intolerance testing is something to consider. You can speak to your GP about lactose intolerance. They can do something like a basic calprotectin test on you, and they'll be able to obviously explore whether you have undiagnosed celiac disease. And then I've put as a question mark dietary change. So it could be that although this isn't a test per se, that we consider something like a low FODMAP diet for a couple of weeks to see whether there is improvement within those symptoms. Although it might not be confirming specifically what is contributing to why you're reacting to the foods, it can help improve symptoms and therefore improve quality of life in the short term while we go about addressing underlying imbalances that might explain why you're reacting to these foods in the first place. So let's look at the tests that we've mentioned in a little bit more detail. The SIBO breath test, as the name implies, is a breath test. It takes 3 hours to do. And essentially every 20 minutes, you are breathing in to a plastic bag and test tube. And the laboratory that you send those breath samples to are evaluating for 2 gases in the breath, hydrogen and methane. And to keep things quite simple, normally those with diarrhea are going to have elevated hydrogen production if they do indeed have a case of small intestine bacterial overgrowth. Methane gas, when that is elevated, is more often associated with constipation. So you can see in these results, the blue line is looking at hydrogen status. And to have a positive SIBO breath test for hydrogen requires a rise of 20 parts per million, or ppm, by the 90-minute mark. So in this example, this individual is positive for hydrogen and therefore positive for having a small intestine bacterial overgrowth. If methane rises over 10 at any point in a test result, that is indicative of a positive methane test. And as I say, that's normally associated with chronic constipation. Then we can do comprehensive stool testing. So we know that when we are looking at a set of results, that a stool that is slightly excessively acidic is going to suggest a degree of maldigestion and malabsorption. Lactose intolerance is a common example which can lead to an excessively acidic stool. Biodiversity can have an impact on transit time, and transit time, which is the rate at which food travels through your digestive system, can impact the microbiome diversity. Lots of research is indicating that this is one of the most important metrics of both gut health and arguably systemic health. So these 2 markers are giving us a really good overview of what's going on from a digestive intolerance sort of perspective, but also from an ecology perspective. How diverse is that ecosystem within your large intestine? And we can also look at what we refer to as the dysbiosis index. the number of deviations from normal within your entire set of results. And put very simply, therefore, the higher the worse and the lower the better. Now we can also look at functional markers. So if we remember to go back a few slides, we spoke about maldigestion and pancreatic function being underlying causes of chronic diarrhea. Well, we can look at pancreatic elastase in the stool. And when we're not producing appropriate amounts, this can contribute to various symptoms, including diarrhea, because it's a marker of whether we're producing enough digestive enzymes from the pancreas. We can also look at calprotectin. This is a marker of inflammation within the gut that is often used to differentiate irritable bowel syndrome from inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. If calprotectin is significantly elevated, it is indicating us that there is inflammation in that large intestine, and that could be contributing to someone's chronic diarrhea. We do also look at secretory IgA and zonulin, which gives us information about what we call the mucosal immune system within the intestine. I sometimes describe this as, if you imagine your digestive tract as a hose pipe and layering the inner part of that hose pipe with Pritt stick, you've got this mucus layer that lines the inner lining of your digestive tract, and it has a protective role to play. It is preventing all of these organisms from penetrating into our circulatory system, which would essentially be very problematic for our health, shall we say. Zonulin is a marker of intestinal permeability, aka leaky gut, and is often going to be elevated when we see things like elevated calprotectin, for example. So we get a good idea from a functional perspective what's going on in that gut as well. Is there inflammation? Is the immune system overly active, responding to something like an infection? Are we producing appropriate levels of digestive enzymes? And do we have good integrity to the gut lining, i.e., do we have leaky gut or not? And then you can see the research paper on the right-hand side. There is research indicating that butyrate, which is a short-chain fatty acid produced by certain bacteria in our digestive systems fermenting our dietary fiber, butyrate has been shown to be incredibly helpful in preventing or improving travelers' diarrhea. And in comprehensive stool tests, you can look at these butyrate-producing bacteria to ensure that you have good levels of them. Now, if someone has chronic diarrhea, you can consider supplementing butyrate in the short term as a way to improve symptoms and quality of life. But in the long term, we want to ensure that we're feeding these bacteria the substrate they require to flourish, which, as we've already mentioned, is ultimately different types of dietary fiber. So making sure that we've got good diversity in our diet is going to be supporting this in the long term. And that's just obviously to emphasize the fact that we're looking at these butyrate producing bacteria. Now, in the infrequent box, in the slide that I shared where we summarized all of those different underlying causes, Giardia was one of those factors. Giardia is a parasitic infection that can often contribute to diarrhea. But we don't just look at Giardia, we look at Entamoeba, we look at Cryptosporidium species and Cyclospora as well. These are all parasites that can contribute to gastrointestinal symptoms like diarrhea. Now, I do want to just touch on bile acid diarrhea, because again, there's lots of research out there around this. And in all honesty, I don't think enough of us are as aware as we should be around the role that bile acid malabsorption plays in diarrhea. Because according to the research, up to 30% of patients with diarrhea predominant IBS have evidence of bile acid diarrhea. And patients with bile acid diarrhea have a higher proportion of primary fecal bile acids within their stool. And this can be potentially due to decreased bifidobacteria and leptin species, as well as an increase in E. coli in their guts. So when we're looking at comprehensive stool testing, we are looking at E. coli and we do look at bifidobacteria. So we can start to see from a microbial perspective Is there a microbiome that is matching this condition or this state of bile acid diarrhea? So yes, we can do stool testing to gain an understanding about whether this might be something that's going on, but there's also blood testing, and there's also a test that would be run via someone like a gastroenterologist, which I just call the CCAT test. So we've summarized the underlying causes of diarrhea. We've discussed some of the most appropriate testing based on some of those most common underlying causes. I always and ah about discussing potential interventions on platforms like YouTube and social media, because I don't want to just throw a bunch of ideas at you. You go away and try them in the hope that they work. The reason being is it can be so frustrating when they don't, and people can get disheartened quite quickly. However, I do at the same time want to provide people with a bit of a roadmap about what to consider. So please bear in mind that these are generalized recommendations. So as an example, if we're talking about what we can do from a dietary perspective to improve chronic diarrhea, well, the dietary changes need to be made based on the underlying cause. So step one is we need to try and understand what that is for you. And to some degree, that is going to require testing. Because in a parasitic infection, there might not actually have to be any noticeable changes to your diet if you're already on a healthy diet. The exception to that is I do have research that I've seen that's been published that talks about garlic and ginger actually being helpful in blastocystis hominis infections, for example. The low FODMAP diet would be appropriate for someone who is FODMAP intolerant. It may be appropriate, and there's certainly research here, in those who go on to be diagnosed with inflammatory bowel disease. But we also have other diets that have been discussed and that can be effective for those with inflammatory bowel disease, such as the autoimmune paleo diet and the IBD AIDS diet. I think episode 7 of the Health Path podcast, I have one of the sort of creators of this diet who discusses the role that the IBD autoimmune inflammatory diet can play within those suffering with inflammatory bowel disease. If someone has SIBO, they can go with the low FODMAP diet, but there are, again, other diets that can be considered, such as the biphasic diet by Dr. Jacoby. I spoke to Dr. Jacoby on episode 4 of the Health Path podcast about SIBO, specifically more methane, so more the constipation side of SIBO. And then in bile acid malabsorption, actually a low-fat diet may be helpful in the short term while we readdress and restore balance to the imbalances which are contributing to that in the first place. So you can see we do have some dietary plans that can be considered within specific contexts, but we still have to first understand your specific context. Now, we have to talk about lifestyle interventions. These are really the foundation for any improvement in our health, especially digestive health. So some people can actually find that daily activity, especially of low intensity, can be helpful for most GI symptoms, diarrhea, constipation, abdominal pain, and bloating in particular. So walking, ideally in natural environments. Yoga has been shown to be incredibly powerful and as effective as conventional medicines and dietary changes for those struggling with irritable bowel syndrome. Breath work can be incredibly helpful for those struggling with IBS type symptoms such as diarrhea. Deep, low, and slow. So a 5-second inhale through the nose with a 5-second exhale, meaning that you've got a breath count of approximately 6 breaths per minute, has been shown to be very calming. It activates the vagus nerve, provides an anti-inflammatory benefit. And if you're breathing deeply and slowly through the nose, you're activating our diaphragm, our main breathing muscle. And that helps massage the abdominal area as well. Any form of stress management, though, may be helpful. Journaling, meditation, Tai Chi, and anything else that you feel appropriate. And mindful eating, eating in a relaxed, calm environment where you are positively engaged in the experience. You're chewing your food thoroughly. We underestimate the power of these basic principles, and we underestimate them even more, I think, when we have acute or chronic symptoms, because they seem so far apart. But please don't underestimate these 4 bullet points if you are struggling with gastrointestinal symptoms. And then we have some really good evidence-based supplements that I am pretty comfortable recommending. But what I will say is speak to your health practitioner before starting any new supplements, especially if you're on medications, because there could be contraindications there. But 2 specific types of probiotic, Lactobacillus rhamnosus GG and Saccharomyces boulardii, have very good evidence behind them in improving diarrhea. The prebiotic partially hydrolyzed guar gum, or PHGG, digestive enzymes, especially in cases where we're not producing adequate amounts of pancreatic elastase, which, remember, is a marker in stool testing indicating whether we're producing enough digestive enzymes from the pancreas. Zinc has research behind it in improving diarrhea, and also psyllium husk fiber can be helpful for some as well. Psyllium husk fiber, as well as partially hydrolyzed guar gum, can actually help both in diarrhea and constipation, which is interesting. So I hope that's helpful, guys. I hope it gives you some options to consider. If you want to learn more about us, you can visit our website, healthpath.com. You can book in a free 15-minute consultation with one of our practitioners through our website. And you can join our bi-monthly webinars where I go through your questions. So in these webinars that are held on Zoom, you email in questions and I spend an hour answering them. So you can do that by joining our newsletter. You'll be kept up to date with when these webinars take place, and I hope to see some of you there. And final little reminder that if you found this video helpful, then give it a like, give it a share, give it a comment, and subscribe to our channel, because we're going to be releasing a lot more content similar to this over the coming weeks, months, and years. So thank you for listening, everyone, and I hope it has been helpful.